Hi, I'm Dr. Masson. Today we're going to be covering population health for nurses in the OpenStax textbook, specifically Chapter 13, which is looking at pandemics and infectious disease outbreaks. So just as an overview, we're going to look at pandemics through history. We're going to talk about different types of infectious disease outbreaks and think about infectious disease prevention and control. So your goals for the end of this should be to be able to distinguish between pandemics, endemics, and epidemics, and also really compare the major pandemics that affect history over the past 2 centuries, and also discuss how the 1918 pandemic changed history. So let's define some of these terms. Now, more than ever, because you've lived through one of these, you should be able to understand what they are because you can see its impact, right? So what is an endemic? So this occurs when an infection or a disease becomes common in a population or an area. Versus an epidemic, this is a notable increase in infection that surpasses the criteria for endemic level. Pandemic, we are very familiar with this word, but do you actually know how to define it, right? Someone asks you, you should be able to say, yes, I can define this. A pandemic is an epidemic that spreads worldwide. So major pandemics throughout history are considered as we talk about this, including COVID-19. So the plague, also called the bubonic plague and the Black Death, there are things that we should be familiar with when it comes to the plague. So one is that it caused a few distinct pandemics. So in 541 to 542, the plague of Justinian killed half of Europe's population. By 1347, the Black Death had claimed an estimated 200 million lives. And then after that, successive waves from 1630 to 1722 affected France, Italy, Netherlands, and England, and then continued in Asia. So this was spread by a flea-borne bacteria and was really associated with rodent. So the plague presented as bubonic, septicemic, and pneumonic, and in 1897 the cause was discovered to be a bacterium. Many public health measures used in COVID-19, such as medical inspections, isolations, quarantines, ship restrictions, and control of movement, really originated. We saw these same things happening during the Black Death. Now, fast forward, we're going to look at the influenza pandemic of 1980. This was avian-borne, also called the Spanish flu, and it was one of the most severe pandemics in recent history. It was caused by the influenza A H1N1 virus. It spread globally. It coincided with World War I, and overcrowded troop movements facilitated this spread. There was really a high mortality rate among healthy young people, and its response was fragmented. There was no government agency really dedicated to disease control and prevention, and there was really no pharmacological treatments or vaccines available. Here, this picture is looking at the 1918 flu pandemic and how some patients were isolated to outdoor, what they called sick wards or influenza wards. So pandemic viruses of 1957, 1968, and 2009. So in 1957, 68, and 2009, there were new strains of flu virus to which people lacked immunity. And these caused flu pandemics. And then after the 1918 pandemic, public health policies and practice really continued to improve. There was an emphasis on surveillance and education and sanitation and isolation strategies, which was used to improve response. The HIV pandemic, so in June in 1981, 5 healthy young men in California developed PCP, and health officials recognized this really unusual increase in the KS among homosexual men in New York. So this was originally thought to be isolated to the homosexual community, but in 1981, cases appeared among intravenous drug users as well, and shortly after that in individuals with hemophilia. The first test for HIV was 1985 after the discovery of the retrovirus. Infection was believed to have developed in the 1800s from a chimpanzee virus. In the 21st century, AIDS has become one of the largest public health challenges, killing more than 39 million people worldwide, 500,000 in the United States. And it's still a global pandemic with cases increasing in Eastern Europe, Central Asia, the Middle East, and North Africa. Diseases can be managed with antiretroviral drug therapy, and there is no current vaccine or cure that's available. COVID-19 pandemic. So in January of 2020, the World Health Organization announced that the outbreak of pneumonia-like symptoms caused by the 2019 novel coronavirus were occurring. They officially named it COVID-19, and the pandemic was declared in March of 2020 after affecting over 100 countries and over 4,000 deaths. In August of 2020, COVID-19 became the third leading cause of death in the United States, and in 10 months, reported mortality from the disease exceeded 1 million globally. Approximately 1 year after the initial outbreak, the FDA issued emergency use authorizations for 2 different vaccines for people greater than 16. So here what you're looking at is a chart that's presenting COVID-19 deaths per million people from March 2020 through March 2023. So this next section, we're going to look at the terms for infectious disease, explain how infectious agents are transmitted, think about the different types of infectious disease outbreaks, talk about vaccines and infectious disease control and prevention. Always, we're going to put this in context of the nurse's role and then identify emerging infectious disease and potential bioterrorism agents. So we're going to start with our definition, right? So the infectious diseases, these are caused by pathogenic organisms or microorganisms like bacteria, viruses, parasites, or fungi. These enter a human host, multiplying and causing infection that can be spread either directly or indirectly. The epidemiological triad, this is the host, the agent, and the environment. The chain of infection, this is the disease. Disease is communicable or contagious if the infected host has a portal of exit, a means of transportation, and a portal of entry into another infected host. And susceptibility of the host is really a key component. So here we're looking at the type of epidemiology, infectious disease. So we're thinking about environments and we're thinking of those as reservoirs for infectious agents. So where can this basically be transmitted? And then the transmission of these infectious agents can be airborne, direct, indirect, droplet transmission. And you know this from, your contact precautions, right? But we're thinking about where does this start? How does it spread? And then the role of the nurse in both the acute care and community setting. So influenza viruses cause influenza A and B, and it's a respiratory infection affecting the nose, throat, and lungs. Influenza A causes the most severe and widespread disease. Minor mutations are occurring each year, and periodically we see a major mutation. Influenza B often has minor outbreaks mutating gradually through antigenic drift. This often occurs in winter months but can be found year-round. It's easily transmitted by droplets of infected material. We see symptoms which are fever, chills, cough, sore throat, nasal congestion, body aches, headaches, fatigue, and sometimes diarrhea and vomiting. So lung infection can cause mild to severe illness in all ages. And we're going to look at this in the United States, where we see this is influenza, RSV, and SARS-CoV-2. We also see bacterial infection like Streptococcus pneumoniae and other forms of bacterial pneumoniae, same as fungal. So these can be found in the soil. It could be contaminated with bird droppings. Some forms are really contagious through droplets. When we think about symptoms, this could be fever, chills, a productive cough, shortness of breath, rapid or shallow breathing, sharp or stabbing chest pain that is worsening with deep breathing or coughing, loss of appetite, fatigue, nausea and vomiting, and confusion. In 2019, pneumonia killed over 2.4 million people globally. For hepatitis, this is inflammation of the liver. The viral forms in the United States are hepatitis A, B, and C. Hepatitis B and C can result in chronic infections and liver cancer. HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system. If untreated, it progresses to acquired immunodeficiency syndrome, and it can be controlled, but there's no cure. It's transmitted through direct contact with infected blood and specific body fluids. There are 3 available tests. Those are antibody antigen tests and nucleic acid tests. HIV antibodies may be undetectable for 90 days after infection. An antiretroviral therapy, ART, reduces viral loads to undetectable levels, keeping the individual healthy, potentially at stage 2. In a public health perspective, you want to be thinking about what it means to take these medications. For example, you're not supposed to take them on a empty stomach. So if you're in a place like Tanzania, the country may offer free antiretroviral therapy, but they don't have transportation that is publicly available or easily accessible. And so someone will be at their house. They have this free medication that can help them with their infection. However, they have no food, so they can't take the medication, or they don't have transportation to go pick it up. So we want to think of this in a public health space, right? Because you can develop some great drug that can reduce this and show efficacy, but will it work in the context of the people who need it to work? And that's, I think, our key role as nurses and nurse scientists, is develop these ecosystems that make these life-saving interventions possible for all people. So tuberculosis is caused by bacterium. It can attack any part of the body. It's spread by airborne transmission. When inhaled, TB bacteria can settle into the lungs, grow, and spread to other parts of the body. People living in congregate settings, like BIPOC individuals experiencing homelessness at a higher risk or more at risk for getting this. So again, we're thinking about the role of the nurse. We're really quintessential in being able to provide these interventions and really thinking about educating the public as our priority. I think we're really well positioned for this, especially because we spend so much time with our patients, more so than any healthcare provider. So we understand the context in which that they're coming to us, and also the context in which they're going from us, right? And I think that's an important juxtaposition, to know that crossroad in order to provide really the best education, because we can kind of bring in both the perspective, what they need if they're going into a healthcare setting, or what they need when they go home. First of all, we have to think about primary prevention of the illness. This is really focusing on the wellness aspect of it, because we know what happens, if they can't stay healthy. When we think about foodborne diseases, these are fairly common, with an estimated 1 out of 6 individuals becoming ill from a contaminated food or drink. And there's 3,000 related deaths a year related to foodborne illnesses. We even see this, locally. You can probably think of a few cases. I think the most recent one probably would be Miguel's, that had the E. coli spread, right? And people, they were hospitalized based on that, and then some people had fatalities based on that. So hand washing, very important. So norovirus, leading cause of vomiting and diarrhea from acute gastroenteritis in the United States across all age groups. It's highly contagious. It's transmitted via fecal or oral route, contaminated through hands, food, or water by direct contact or contaminated surfaces. The foods are commonly implicated are leafy green vegetables, fresh fruits, and shellfish. We can see this here. It's about washing the fruits and vegetables well, washing the hands well. Okay, so salmonella bacteria, it could be classified as typhoidal or non-typhoidal. It's estimated 1.35 illnesses and 420,000 deaths annually in the United States. It lives in the intestines of tracts of humans and amphibians, reptiles, poultry, and other birds, and in the feces of some animals. It's also found in foods like chicken, turkey, beef, pork, eggs, fruits, and vegetables. Salmonella increases illness, results in mild to severe diarrhea illness, and most people recover within 7 days. And as you can see here, it definitely impacts the San Diego community. So it's important to be aware of how this is presenting and how to prevent it. So E. coli is a bacteria usually found in human and in animal intestines. It's mostly harmless, but some causes are diarrhea, respiratory illness, and the urinary tract or bloodstream infection ranging in severity. The type is a Shiga toxin producing E. coli, and this one is most commonly associated with food outbreaks. It's in contaminated food, unpasteurized milk, untreated water, or contact with cattle or feces of infected individuals. Its symptoms can present and then last within 5 to 7 days. It could go from mild to life-threatening. So the role of the nurse, again, we have to educate. We really have a responsibility to educate. Number one priority. And you can see here, this is all on hand washing, right? So nurses can go into the schools, educate all elementary through high school nurse, right, on washing hands before and after meal prep, washing food before it's eaten, teaching to heat up any sandwiches or deli meats before it's eaten, to make sure chicken is really cooked, all meats are cooked through, and this will help prevent any of these illnesses. So vector-borne diseases, what is this? These are infections that are transmitted through vectors. So living organisms such as ticks and mosquitoes. When a vector ingests a pathogen from the blood and infected host, they can transmit that pathogen to the new host. So global vector-borne diseases are responsible for more than 17%. So Lyme disease is one of the most common vector-borne illnesses in the United States. It's spread by the tick, particularly, and the symptoms of early localized disease include fever, chills, fatigue, headache, malaise, arthralgia, and also we see erythema, lymphadenopathy, migraines, a red ring-shaped rash at the bite site. Rash visibility differs depending on skin color and tone, and if it's untreated or undiagnosed, it progresses to a disseminated disease. So you can see a picture of this bullseye rash, and then there's also erythema and migraines, and these are really characteristic signs of Lyme disease. And then you can see that the appearance of the erythema margins can vary, and they appear different on different skin tones. So the West Nile virus, this is spread by bite of an infected mosquito, leading cause of mosquito-borne illness disease in the United States. Most infected individuals have no symptoms, but 1 in 5 experience fever, headache, body ache, vomiting, and diarrhea. They should be considered in any person, so with febrile or acute neurologic illness, so you want to be thinking about this, recent mosquito exposure, blood transfusion, or organ transplant, and causes must be reported. So it's a nationally notifiable condition. So Zika virus is caused by a mosquito as well, and it's found in the United States, and it can be passed from fetus to mother, possibly causing birth defects. And then malaria is caused by a parasite that often infects the mosquito and is then transmitted to humans through this mosquito's bite. They are also flu-like symptoms, sometimes with anemia and jaundice, and it is also a nationally notifiable condition and needs to be reported to the health department. So as a nurse, the main role is really understanding these vector-borne diseases, knowing what to look for in your assessments, reporting these. If you're at the county, they have to call and report to the health department. If you're at the hospital, you have to also call and report. And then education programs to decrease infection. So consistent sanitation measures and drinking water treatments have made these conditions rare in the United States, but waterborne diseases, infectious disease outbreaks do occur. The Safe Drinking Water Act of 1974 allows the EPA to set and enforce standards for drinking water and quality. The CDC estimates that 1 out of 44 individuals become sick from waterborne diseases each year. And the two most common types are respiratory or intestinal in nature, and waterborne pathogens infect people when they breathe in contaminated droplets, as in heating and cooling systems, or when infected water gets in the ears or mouth while swimming. When we think about nurses in this setting, again, primary prevention, education to know what they are, to avoid swimming in areas that may have these higher rates of infection. Same thing with foodborne diseases. Okay, so now we're going to talk about infectious disease and sexually transmitted diseases. So these are transmitted from person to person through vaginal, oral, anal sex. It's estimated that 1 in 5 individuals in the United States are affected by STIs. Some are symptomatic, some are asymptomatic. When we think of chlamydia, it's most frequently reported bacterial STI. In 2018, estimated 4 million chlamydia infections occurred in the United States. In women, if it's untreated, it can lead to pelvic inflammatory disease, tubal infertility, ectopic pregnancy, and chronic pelvic pains. This is why this is screened for in the ED if someone comes in with these complaints. And then in men, it's untreated. Cases rarely cause any complications, except that it can cause infertility. The second most commonly reported bacteria STI is gonorrhea. Any sexually active individual can become infected, but most cases are among teenagers, young adults, and Black individuals. Symptoms in women are often mild and are mistaken for bladder or vaginal infection. And symptoms in men include discharge, potentially testicular or scrotal pain, rectal and vaginal infection are common. And if latex condoms are used regularly and properly, this can reduce the risk of gonorrhea. In terms of bacterial STI, the incidence has grown. So in syphilis through the last 20 years, so congenital syphilis occurs when a person passes syphilis to a fetus and spreads directly with direct contact with a syphilitic cancri, and symptoms could include this typical stage of progression, so each lasting for weeks, months, or years. And then again, this is one where condoms can reduce the risk if it's covering the lesion. So nurses are in that place where they can educate, whether that be if they're in school nursing or in a public health setting, or even if they're interfacing in the ER where some screening is happening. So early detection is key, and then getting treated appropriately. Now we're going to talk about vaccine preventable diseases. It's a significant public health victory that many diseases have been eliminated in the United States. These include diphtheria, measles, polio, tetanus, and rubella. Although when the vaccine rates drop, we see increases in these. And the CDC recommends vaccines to prevent a list of diseases. Only 70% of children born in the United States have received the recommended vaccines by age 2. And as fewer children are vaccinated, then we are seeing re-emergence of these vaccine preventable disease outbreaks. So emerging infectious disease, these are defined as those that are newly affected populations or existing diseases that previously only caused an isolated disease but now are increasing. Many are zoonotic in origin, emerging from animals and crossing over species barriers to infect humans. Often for these diseases, there's minimal effective treatment and no cure, and healthcare providers are really vulnerable through contact with these diseases. So we're going to now transition. We're going to talk about public health surveillance, explain those steps, describe how outbreak is established, discuss the steps in outbreak investigation, talk about foodborne and waterborne disease, and the nurse's role. So public health surveillance is ongoing systematic collection, analysis, and interpretation of health-related data. It's essential for planning, implementation, and evaluation of public health practice. It refers to monitoring communicable diseases, non-communicable disease, injury risk factors for health outcomes in a population, and selecting and prioritizing health problems, which involves really identifying those issues that impact public health. So communicable diseases more commonly are under surveillance. There are local and state health departments that are responsible for notifying the CDC about agreed upon notifiable diseases and health conditions. So basically, case surveillance happens every time a public health agency collects information about an individual diagnosed with a threatening condition in society. So outbreak investigation means more cases of a certain disease or health condition than expected. These are determined through that surveillance data, which is part of why it's so important. And then the CDC regularly uses this surveillance data and laboratory patterns to detect clusters of diseases. Healthcare providers can alert the local health departments about unusual cases. So again, that's where these nurses are then alerting the public health departments, and community members can also alert the public health departments. And then the decision, it hinges on many important factors. So how severe is the illness? How many numbers of cases? What's the mode of transmission? And what are the prevention control strategies in place? So here you're looking at this nasal sample being taken by a team that's screening for disease. When we think about foodborne disease, we're talking about prevention really requires careful oversight and monitoring along the food chain. So the CDC, U.S. Department of Agriculture, the Food and Drug Administration, and local and state public health departments, they're all working together. They're looking for food safety, and whole genome sequencing really uses this advanced technology to assist with finding foodborne outbreaks. And the CDC is using what is called a 7-step process for these investigations. So here you're looking at a disease detective in the works looking to gather data on this outbreak and use that surveillance data to then give more information to inform public health strategy. So when we think about surveillance for prevention of waterborne diseases, this means preventing waterborne illnesses. It's really multifaceted. So consumers need to know where their water comes from, right? Do you know where your water comes from? That's the question. And understand the testing and test results that are conducted. So community water systems often use groundwater and regulated by the EPA. Sometimes the water systems are unsafe, as they were in Flint, Michigan. So if you have not heard about the Flint water crisis, please look it up. It's a huge public safety issue where the Flint water was directed from another water source that they knew was not great. And this was decided on a like governmental level, and the water that they chose had lead, and then people were getting lead poisoned, and it was causing health issues. They said they were turning on their water, it was coming out kind of this brass color, and were not listened to for a considerable amount of time. So look up the Flint water crisis. But many households rely on private wells, so this is another way, and those have to be maintained and tested. So the CDC provides guidance on ways to really mitigate waterborne pathogens in devices that use water like humidifiers. So water can be safe, but if it sits in pipes, it becomes contaminated. So here we're thinking about the nurse's role. There are really 3 core functions of public health nursing, and nurses are involved in this assessment. We spent a lot of time on assessment, and then epidemiological surveillance and detection, right? And school nurses are really well positioned as well. So in New York City, they first noticed and reported to the CDC about the H1N1 flu. During COVID-19, nurses really did most of the contact tracing at the local Board of Public Health. They look at both assisting with the implementation of disaster plans at the local and state level, so if there was something there. And then during an infectious disease outbreak, the nurses, they need to kind of fill in the gaps, so to speak, wherever the need is, that's where we go. And this is hard, right? This can be challenging to switch roles to be on in these critical moments. And they have to be protected against these diseases that they're surveilling for, and so if they feel unsupported and unprepared, that can cause some trauma. So thinking about really their role in infectious disease, we have to be able to be prepared and be supported and have the resources we need, and we're really vital in this primary, secondary, and tertiary prevention. Thank you.